The SNAQ is just what it sounds like. It's about food, and SNAQ stands for the Simplified Nutrition Appetite Questionnaire. We recommend that anybody over the age of 60 who comes into the office should be administered the SNAQ because it's a preventive questionnaire. The idea is to identify people who are at risk for losing weight within the next 6 months. Mr. Myers, how nice to see you.
Thank you.
I'm Dr. Tomosa.
Hello, doctor.
How are you doing today?
Oh, well, not too good, but I'm all right, but I'm not feeling too well.
Not as good as you usually feel.
That's right.
Oh, okay. Well, let's see if we can get to the bottom of that.
Okay.
I have a few questions that I'd like you to answer for me. And what we're checking right now is to make sure that you're getting enough nutrition. I want to ask you a few questions today about your appetite. I want to know whether or not you are at risk for losing weight over the next 6 months or so, because this is the sort of thing we worry about. If you're not getting enough nutrition, then your immune system begins to fail and you don't feel very well. Since you're not feeling very well today, I'm a little bit concerned about that.
Okay.
So
ask
I'm going to,
That's
great,
fine.
good. I'm going to ask you, I'm going to make 4 statements and give you 5 possible answers. Just tell me which one of those 5 answers best represents the way you feel.
Okay.
All right?
Sure.
Ready?
I'm ready.
Okay. My appetite is very poor, poor, average, good, and very good.
Recently, it's just been very poor, I think.
Really poor?
Yeah.
Okay. When people lose about 5% of their weight in 6 months, then they become at risk for a weakened immune system and osteoporosis. Their bones become quite weak and they become frail, they become anorexic, and they become malnourished. The SNAQ consists of 4 questions. Each question has 5 possible answers, listed A through E. The A answer is worth 1 point, the E answer is worth 5 points. So to take the whole questionnaire, the patient could get a maximum score of 20. If they answer A for each of the 4 questions, they have a minimum score of 4. What we're concerned about is that patients who have a score of 14 or less are at risk for developing weight loss of greater than 5% within the next 6 months.
Recently, it's just been very poor, I think.
Really poor?
Yeah.
Okay. All right.
Afraid so. And not for a long time, but it's getting gradually more and more
So this is
poorer
just
and
beginning
poorer.
then.
Yeah.
Okay.
Yeah.
All right. Well, this is a good time for you to take this test then.
Okay.
All right. Food tastes very bad, bad, average, good, or very good?
Let's see. What's the first one?
The first one was very bad.
Very bad.
Followed by bad.
No, it's not very bad, but it's not good. I say it's bad most of the time.
Bad most of the time. All righty. Okay. So when I eat, I feel full after eating only a few mouthfuls. I feel full after eating about 1/3 of the meal. I feel full after eating over half of a meal. I feel full after eating most of a meal. And I hardly ever feel full.
I'd say a third.
A third.
About
okay.
a third.
So you would say, I feel full after eating about 1/3 of a meal.
Right. I start and then it doesn't taste good, and I feel like I want to stop, so I feel full.
Okay. All righty. Then the last statement I want you to give me an answer to. Normally, I eat less than 1 meal a day, 1 meal a day, 2 meals a day, 3 meals a day, or more than 3 meals a day.
Well, I try to eat more than once, but I'd say on the average, maybe just 1 meal. You know, if I eat all the meal,
Right?
just once.
So
And maybe a little snacking, but only 1 full meal a day,
Okay.
I would say.
All right, so I'm going to put you down for one meal a day then.
Okay.
Okay. Well, in looking at how you answered your questions, I would have to say that I'm a little bit concerned about you. And maybe this is why you're not feeling so well. Yeah. So the SNAQ has now done its job. The patient has been identified as being at risk for weight loss within the next 6 months. We have now plenty of time for the healthcare team to step in and intervene to fix whatever it is that's causing the problem, so they will prevent the weight loss before it even happens. This is a case of an ounce of prevention is worth a pound of cure.